Hello, this is Dr. Grande. Today the question is, what is a process addiction? So when we're talking about mental health disorders, it's not unusual that we run into substance use disorders. And we don't fully understand how these work, but we generally understand the consequences. So you have someone who starts using substances, and at some point, because of some changes to brain chemistry and other factors, they have difficulty stopping the use of substances, and sometimes really lose almost all control or do lose control of their ability to stop using. A process addiction has really the same feel as a substance use disorder, except without a substance, at least not with a traditional substance like alcohol or heroin or cocaine or something like that. Common examples of process addictions would be gambling or shopping, or someone who has difficulty cutting back their usage of the internet, the amount of time they spend on the internet. We can also see process addictions with eating. And with process addictions, because they're not all categorized really as mental health disorders, it becomes difficult to distinguish a process addiction from just overuse of the internet or overeating or shopping too much. Another problem with identifying and treating any type of process addiction is that someone needs to eat to survive. Someone needs to shop to survive. And for many, people need to go on the internet to survive. Now, gambling or something like that's a little different. You don't need to gamble to survive. But for the other behaviors, which in moderation would be normal, you're really looking at a process addiction as an expansion of those behaviors. So cutting back can be difficult. Also, with the presence of a substance, I think most people would understand the concept that the substance has an effect on the brain. Therefore, somebody's ability to control their use is compromised. With process addictions, I think many people are a little more skeptical. Can somebody really be addicted to the internet? Can somebody really be addicted to gambling? In a sense, somebody could look at these behaviors and say, why not simply stop? It's not the introduction of a chemical into the body. It's a behavior that somebody has to actively engage in. They choose to do it without, in theory, the impact on the brain. But what we're finding in the research about process addictions is that there is a change in the brain. There is a change in the brain when somebody becomes addicted to a process, even without substances being involved. So it appears that substance use disorders and process addictions have a lot in common. And when you look at how we would treat a process addiction as compared to a substance use disorder, the treatments have similarities as well. Cognitive behavioral therapy, trying to reduce the triggers in the environment. For example, if someone is using the internet to a point where it's considered a process addiction, we may put a plan to restrict how much internet access is available. If someone has a process addiction to shopping, we may limit how much can be spent in a specific month. You may work this out with a client and come to some sort of agreement. And that would be a way of trying to reduce the exposure to the situation that's causing the addiction. Another question I get related to this is, are process addictions real? Are these real conditions? And I think whether they're in a diagnostic class or not may be certainly important at some level. But what might be more important, in my opinion, is if somebody believes that they have an addiction to some sort of process and there are real consequences, it's causing clinically significant distress, then it's understandable it would be a focus of treatment. And whether it's classified or real in terms of what's published and what's generally understood as addiction may not be that important to a client. Clients oftentimes want the symptoms reduced. So if a client has trouble shopping, they're shopping excessively, it's causing financial problems, then it seems logical that would be a focus of treatment, really regardless of the lack of diagnostic class for that type of illness. Process addictions can be difficult to treat, and of course substance use disorders can be difficult to treat, and it's not unusual that somebody with a process addiction would also have a substance use disorder. So we see here this change in the brain can occur with an object that's not a substance, with an object that is a substance, and both can happen. Just like in the case of substance use disorder, it's not unusual if somebody is using one substance and they qualify as having a substance use disorder with that substance, that another substance or even more than two would be involved. They could have several substance use disorders. Process addictions are generally thought of as not as dangerous as substance use disorders, which makes sense. However, certainly some process addictions for certain people can be very dangerous, and both warrant mental health treatment, both substance use disorders and process addictions. I hope you found this description of process addictions to be helpful. Thanks for watching.